Hi, welcome to the show. You're watching Your Future, Your Finances. I'm your host, Brian Kuhn. We have a great segment for you today. We're speaking with Tracy Russo, all on the topic of Medicare and long-term care planning. Tracy is a managing partner of HTA Financial Services and has been in the certified in Medicare and long-term care insurance for over 15 years. You're the director of HTA's Medicare Client Services Center, also certified in as a trainer of Medicare and long-term care services, and conducts a number of public speaking and education programs on the topic. Sound good? Thank you for coming on the show.
Thanks so much for having me.
So tell us a little bit about what Medicare is. A lot of people get confused on the different government programs and who's eligible for that.
So Medicare is the health insurance that's provided by the government. It's available to anybody once they turn 65. It has nothing to do with normal retirement age. So at 65, you become eligible for this insurance. Also, if you're under 65 and disabled and on Social Security disability for more than 24 months, you can be eligible for Medicare. And for people that have end-stage renal disease or permanent kidney failure also are eligible for Medicare.
So 65, that's a pretty important age. People get a lot of mail at that time. It's been my experience. So
sure do.
And sometimes they talk about penalties, I guess, if you don't do it. Are there penalties for not signing up?
There could be. So basically the way it works is if you're an individual who's retiring at 65, or maybe you're self-employed or you've already retired and you're on individual health insurance, then you definitely want to enroll in Medicare at 65, or you could get a penalty. The enrollment time period is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months following your 65th birthday. If you enroll outside of that time, then you start to accrue a penalty, and the penalty is 10% per year for every year you should have had it but weren't yet enrolled.
10% a year, that's a lot. How about people who are working? Let's say they want to, or they feel like they need to work past 65 and they have health insurance through their employer.
Well, we're definitely finding that more and more people are working past 65, especially since for Social Security income, the normal retirement age is going up to collect your full benefit. So if you're working past 65, you can stay on your group health insurance in many situations. And I think the key number is look at the employer that your health insurance is through. So that may be your employer, or it may be your spouse's employer. If that employer has more than 20 employees, then most of the time the group health insurance is considered credible coverage for Medicare purposes, which means that you don't have to enroll in Medicare. Your group health insurance remains primary, and you will not get a penalty for not enrolling in Medicare. So many people that fall into that category defer Medicare when they turn 65.
Okay, so, and then how about for, let's say you work for a company that has less than 20 employees?
Well, so that's the tricky one, and most people don't know about this, but if you work for a company with less than 20 employees, Medicare is actually primary to that group health insurance. And because of that, you definitely want to enroll in Medicare. And this is where we're finding that there's a lack of education. There's many people, they feel that they're still on group health insurance. They don't have to think about Medicare right now, especially business owners that are busy with their practice. So you want to enroll in Medicare, and there's three main reasons why, or three risks that would be involved if you didn't enroll. And the first one, of course, would be that penalty that I stated. Because your coverage is not considered credible coverage for Medicare, being in a smaller group, you would start to accrue that 10% penalty when you turn 65. So if you retire at 68, you're going to end up having a 30% penalty added to your Medicare Part B premiums, and you will have them for the rest of your life.
Even if the coverage you have is the same as what an employer over 20 employees?
Even if the coverage is the same. It specifically says in Medicare guidelines, under 20 employees, Medicare is primary. But there's two other risks as well, and I think one of the biggest concerns is when that person actually goes to retire. If you don't purchase Medicare when you're supposed to, you're only allowed to purchase it during a general election period. So let's say a client came to me in April and said, Tracy, I'm retiring, I'm ready to go on Medicare, and we find out that they didn't have the credible coverage. They were in a small group. They'd have to wait till the general enrollment period to enroll, which is the first quarter every year. So we're in April now. They'd have to wait till January to enroll. but their Medicare wouldn't even start till July of the following year. So they could be 15 months without any health insurance coverage.
Wow.
So there's a big risk there. And then the third risk would be a gap in coverage. So you think, okay, I have group health coverage, I can go to the hospital, I can go to the doctor, everything's going to be covered as usual. But because at 65, Medicare becomes primary, the health insurance company has the right to not pay any claims that would otherwise be paid by Medicare. So this is a big shock to somebody when they go and, God forbid, there's chemotherapy, outpatient chemotherapy. Let's say the bill was $30,000. Well, Medicare would have paid 80% of that had you been on Medicare. So they go to their group health company, they get a denial of the claim, and the group health company says, oh, we're only on the hook for $6,000, the other 20% that Medicare wouldn't have paid. And now this client's left with a very large medical bill and no insurance to pay for it.
So it seems like just like most occupations, you'd rather have a client come to you and say, this is the timeline I'm thinking about into the future, as opposed to this is what I just did. Can you help me?
Pre-planning is definitely the key, and nobody's really the same. It really depends not only on your group size, but does your spouse need to maintain coverage? Are they under 65? And a number of other factors. So we strongly encourage our clients and the financial advisors that we work with to have their clients call us right around their 64th birthday, because we can do that pre-planning. We can do that education with them, and we can set them up for success so they don't have to worry about those penalties and lockout periods.
Fantastic. We got to take a break. A lot of good stuff. We'll be right back with Tracy Russo of HTA Financial Services regarding Medicare and its supplements. You're watching Your Future, Your Finances.